Thank you very much for inviting me to come and speak to you today. As Sophie kindly said, I'm the Associate Director of the Southampton Academy of Research. I'm a nurse by background. I've worked in intensive care for a very long time, and I'm also one of the NIHR 70 at 70 alumni. So that's the Senior Research Leaders programme that was introduced about 3 years ago. And I'm going to give quite a broad brush approach to embedding research. So not just talking about clinical academics, but talking about embedding research in general. So we have a mantra at UHS, at University Hospital Southampton, where we're trying to make research everybody's business. And we see there being three aspects to that. It's about facilitating our patients and our staff to engage with research at whatever level. It's about delivering research studies, and it's also about developing and leading research. And we think each of those are important. And I'm working very closely with people to try and deliver on all three aspects. Yeah, so the first thing is you've got research, which is something that you devise a protocol for, you go for ethics, you know, it's a very prescribed activity. And the word research can actually often cause people quite a lot of anxiety, and they feel, well, I'm not clever enough to do that, or I'm, you know, I don't have a skill set or anything. So there are other things that I think we need to think about as being research that can help us move into that area. So we mentioned audit, which I kind of think of as research as being doing the right thing, and then audit being doing the thing right. So it's about working out that we are actually doing the best thing that we can be for our patients. And then you mentioned also implementation science. So implementation science is about taking that evidence-based healthcare research and implementing it actually into healthcare on a day-to-day basis. Still very, very useful, good skill set to develop, and improves care for our patients. And then we've got quality improvement, which was also mentioned, where you're using protocols to try and improve the way that you address issues that you have. And then finally, I've just put in systematic review, which is a great first tool to dip your toe in the water with research, because you're just basically going out there and really, in a systematic way, going out and finding out what the latest data is on the problem that you're trying to address. So if we want to make research everybody's business, then we have to make it easy for people to engage with research. So if we're just wanting people to facilitate people to engage with research in that ward, then you might have leaflets about research studies that patients could engage with. You might put posters up to encourage people to engage. You might add into your questionnaires questions that you ask when you're admitting a patient. You might put in things about a question about are you interested in a research study? So if you make it very easy for people to just bring research into their everyday work. And then if we're talking about delivering research studies, then it's about making sure that you engage with your research delivery teams within your hospital. You know, Southampton has a very large research delivery team. We have over 300 staff that are specifically employed to just deliver research protocols within the trust. And so we have specific research delivery staff who work within each ward to try and encourage research, embedding research. And so that would be something that we try and get people to do. And then if you're wanting to get your staff to lead research, then it's about identifying training and funding opportunities. And that's something that the Research Design Service can help you with. But it's also thinking outside the box, thinking about going to your hospital charity and seeing if they're going to help, if they can help you. Thinking about other charities involved with the specialism that you're involved with, seeing whether they've got any money. And it's about utilising current job roles within your organisation that might have a research component. So are we making enough use of our advanced practitioners, for instance, because they're supposed to have 4 pillars of practice, one of which is research. Are they really utilising research? And the evidence suggests that most of them aren't. And then you might think about doing something like an implementation lab or setting up a task and finish group. There are hospitals, unfortunately, we haven't managed to establish this at UHS yet, but there are other hospitals in the country where they have these task and kind of multidisciplinary task and finish groups. So a ward will sit down and say, what's a problem we really want to address? And then they will develop a multidisciplinary team, and they will set themselves a goal of 6 months to just go out and try and find out what's the evidence and what's the best way to do that. And then they might write it up, but not necessarily in a formal way to go out into a paper, but it's just a way of bringing a team together to really explore a problem that is relevant to them. So it's also about not making engaging difficult. And this is something that if you're at a management on a ward level, for instance, this might seem a very, very big ask, and this is not something that you're going to fix overnight, but it's about making sure that your trust strategy has research fundamentally as part of what it's trying to achieve. It's about getting research into your appraisal documentation. So are all your staff required to engage with research as part of their role? And looking at job descriptions and seeing whether you can get research into all and facilitate. It might just be about facilitating research or just making sure that they know what sort of research their patients can engage with and encouraging them to engage with it. It might be that simple, but just making research just part of every day and not something extra. So it's also about highlighting those positives. And again, that might be something that you need to do at a higher level, but we know that research engaged trusts have better patient outcomes, and we need to sing about that. And we know that research opportunities can assist with recruitment and retention. We've set up a research leaders program in Southampton recently, and we've had staff who have applied to join the trust because they've heard about the research leaders program and they've said, I want to work with a trust that offers that opportunity. We run something called Scratch Your Itch sessions, which is we say to people, what's the thing that really bugs you at work every single day? Well, if that bugs you, come and talk to us about how you can scratch that itch and sort it out. And it's we have them every 3 months. We have a number of different research champions within our trust that help us talk to these people. Most of them have never really dipped their toe in the water of research before at all. And it's a great opportunity in a safe environment to say, I would like to look at this question, or I'd like to see what it might be like. And then shouting about every single piece of research that you do or audit or things that make a change. They're really good, feel-good news stories, and your comms team will want to shout about those. So engage with your communications team to get those messages out. Now, we have a couple of things that we do at Southampton, which you may do elsewhere. We have these joint roles where we have individuals who part-time are employed to do research delivery within the R&D department, and part-time they are engaged to work clinically on the wards or on the intensive care unit. And that's a great combination because it then again gets people talking about research in that clinical environment, and also it really helps you with picking up those patients that might be eligible for studies. And we also have link roles where we have individuals who are, in the same way you might have a tissue viability link nurse or an AHP or a infection prevention nurse or AHP, you can have someone who's whose job it is within that environment to link with the researchers and help embed the research in that local area. And you can then build that cohort of link nurses and AHPs across the trust and have development days. So there are people out there who can help. And this was another moment when I was going to get you to think about all the different people that you might, or organisations that you might get to help you embed research. So internally, you might go to your audit team, who might help you if you're wanting to do an audit, or your implementation team, R&D department. We have all of those within the University Hospital Southampton. We have our hospital library, who are very, very keen to help you with doing searches on the databases. And then, as I mentioned, the hospital charity might be, they might be able to work with you to offer up scholarships to attend courses or do many bits of research. And then externally, you've got the research design service. You've got your local ARC, your local applied research collaboration. There's professional bodies and the grant funding bodies, and then the NIHR incubators like Wessex Reach. And as our colleague mentioned, patients in the public, which I'm ashamed to say I should have put on there, and is actually a very good point. So I just popped some references which you'll have in your booklet at the end, which is probably more related to clinical academic development than some of the broader issues that I've covered, but hopefully that wasn't too off-piste. Anyway, thank you for listening.